Hi, my name is Natalie Dillon, and today I'm going to be demonstrating how to efficiently pack a wound and apply pressure to it. So for today, I have my jumbo water bottle, and it has a hole cut in it, and that's going to be representing our wound. So obviously, first thing you would want to do arriving to a scene is make sure that the scene is safe. Make sure you have your PPE and BSI. I unfortunately don't have any more gloves at my house, so we're just gonna have to pretend that I am wearing them. And you would want to wear gloves because you would want to be protecting yourself from bloodborne pathogens that you could potentially receive from this patient. So after that, you're gonna want to make sure that you call 911 onto the scene so that they can further assist the patient. But in the meantime, it's going to take them a while to get there. So in the meantime, we're going to locate the area that is bleeding, obviously. And then we're going to take some hemostatic gauze, and I don't know if this is going to be effective for you to see, but you would want to pack the wound with the gauze, and then you would want to continue to apply pressure over the wound until the bleeding stops, slows down, and you would want to make sure that you still are applying pressure until EMS arrives. You don't want to take what you've already put into the wound out, because that would almost reset everything that you just did, and chances are the blood is not going to be clotting that quickly, so you would just be forcing yourself to start from square one. So you want to make sure you leave everything that you used to pack the wound in the wound, and you maintain applying efficient pressure and level pressure to the wound until EMS arrives on the scene and they can further help the patient. If the situation required it, you could also apply a tourniquet, but in this situation, we don't need to worry about applying a tourniquet. So yeah, we would just wait for EMS to arrive after this.